Tonight, Carrie Ann Collins, who was severely burned at her home as she prepared a meal late last month, has died. Detectives from St. James are probing the abduction of 18-month-old Akeelia Patton, otherwise called Paris, of James Hill, Clarendon, and retirement in Granville, St. James on Monday. Still tonight, Jamaica yesterday recorded one additional COVID-19 death, taking deaths to 266, as well as 98 new cases, taking cases to 11,369. And Tourism Minister says the ministry is concerned about ensuring that the risk and the uncertainty during the current pandemic is being managed and mitigated.
Our job in a pandemic, which is characterized by uncertainty, a magnitude of which the world has never seen before, is not to do all the things that is imaginable to be done, but is to do all the things that we should do well.
Good evening. In a Mello TV news update, Carrie Ann Collins, who was severely burned at her Kingston-based home as she prepared a meal late last month, has died. Now, Kimmy Kaloban, organizer of a GoFundMe page created to raise funds for Ms. Collins to be airlifted overseas for medical treatment, shared the news on the crowdfunding website earlier today. Up until this morning, $19,065 was raised of the $773,000 goal from the crowdfunding efforts. Ms. Collins had been admitted to the Kingston Public Hospital KPH since November 27 with little hope. She had been suffering from severe pain. Now, reports coming into our news center are that Ms. Collins was trying to prepare a meal at her dwelling at Palm Grove Court of Spanish Town Road in Kingston when the gas stove that she was using exploded. Her mother, Delsita Anderson, said last week that Collins suffered third-degree burns from her neck down. In an update on the weekend, the family had reportedly collected US $45,000, approximately 6.6 million Jamaican dollars in donations. According to Stephen Josephs of the San Mara Foundation, an organization that was assisting the family in their fundraising efforts. Among the funds raised was the airfare of US $15,500 to airlift Ms. Collins to the Jackson Memorial Hospital in Miami, Florida. Despite the donations, more funds were needed, resulting in the GoFundMe being launched. Medical officials at the hospital were ready to accept Collins, but the administrators had insisted that all the costs must be paid up front before they would accept her. Up to yesterday, the family was still appealing for more donations to assist in Ms. Collins's medical expenses. Still making news tonight, Jamaica yesterday recorded one more COVID-19 death, taking total deaths to 266. The deceased is a 60-year-old woman from Kingston and St. Andrew. Meanwhile, there were 98 new cases ranging in age from 6 to 95 years, taking total cases to 11,369, with 3,560 active cases. Of the 98 new cases, there were 56 males and 42 females, ranging in age from 6 to 95 years. 31 of the cases were recorded in St. Catherine, 15 in Kingston and St. Andrew, 12 in St. James, and 11 in Westmoreland. St. Anne recorded 9 cases, while Clarendon recorded 7, and St. Elizabeth recorded 6. Hanover, St. Mary, and St. Thomas each reported 2 cases, while Manchester recorded 1 case. In the meantime, there were 98 additional recoveries, taking the total of recovered persons to 7,390. 89 persons are currently in the hospital, 24 of whom are moderately ill and 7 who are critically ill. 2 persons are in government quarantine, while 27,976 are quarantining at home. Still making news tonight, the Ministry of Health and Wellness has named a national COVID-19 vaccine commission comprised of a multidisciplinary, multi-stakeholder group of persons. Included are representatives from the Ministry, the National Health Fund, the Ministry of Finance and the Public Service, the Medical Association of Jamaica, the Nurses Association of Jamaica, the Medical Doctors Association of Jamaica, the University of the West Indies, the Jamaica Council of Churches, the Private Sector Organization of Jamaica, and the Jamaica Defense Force. Portfolio Minister Dr. Christopher Tufton, who made the announcement during the sitting of the House of Representatives yesterday, said the commission had its first meeting yesterday. Minister Tufton also pointed out that Jamaica is procuring a vaccine through the Global Access Facility, COVAX, which is a collaboration with the World Health Organization, WHO, United Nations Children's Fund, UNICEF, the World Bank, the Global Alliance for Vaccines and Immunizations, Gavi, and the Coalition for Epidemic Preparedness Innovations, CEPI. Dr. Tufton further stated that the projected schedule is to have a vaccine ready for administration to about 1% of the initial 16% of the population by April 2021. With another 3% by mid-2021 and the remaining percentage by the end of 2021. In other news tonight, the government announced that preparatory work on 3 major infrastructural projects in the health sector has commenced. These are construction of a new hospital in St. Catherine, a corporate office for the Ministry of Health and Wellness, and redevelopment of the University Hospital of the West Indies, UHWI. Minister of Health and Wellness Dr. Christopher Tufton said that the ministry is seeking to contract 3 project managers for the projects. The minister noted that the projects form part of a 10-year strategic development plan for the delivery of improved health care. The plan is to build a Type A hospital for St. Catherine to meet the rising demand for tertiary services due to population growth. Now, it is projected that by 2021, 599 hospital beds will be required for the parish, and by 2031, the figure will move to 644 beds. The Health Ministry has indicated that the infrastructure at the Spanish Town Hospital is aged and has been recommended for replacement. The work to be carried out at the UHWI includes improvement to outpatient or ambulatory surgery, lecture rooms, conference rooms, upgrading of the cardiology hybrid interventional surgery room, and the neonatal intensive care and administrative departments. In news from the capital, Mayor of Kingston Delroy Williams says the municipality will be stepping up operations in the downtown business district as the holiday season progresses to ensure health protocols are followed.
The festive season has already started. We are stepping up our operations in terms of the municipal police and the municipal security, in terms of their activities within the commercial centers of the city, and those would namely be now, as you would know, downtown, Market District, the Halfway Tree and Papine area. So we are stepping up our activities to ensure that persons operate within the confines of the orders and understand that this is a different situation now. So far, I would say we are doing good. I'm not going to say it's going to be easy, but we have been trying to allow economic activity to continue within our urban centers as we implement the various measures of social distancing, wearing masks, sanitizing, and so forth. So the municipal police will be out working closely with the JCF to ensure that those protocols are observed.
Now, following yesterday's monthly meeting of the Kingston and St. Andrew Municipal Corporation held at the Jamaica Conference Center in downtown Kingston, Mayor Williams pointed out the challenges that the municipality is expecting as seasonal vending will increase in the urban centers and public spaces.
The challenge for us is that we do expect what we call seasonal vendors to appear within our public spaces or urban centers as they normally do at this time of the year. And so we have been preparing for that. We will have a series of meetings this week to ensure that we are ready, and then we'll be monitoring the situation on a daily basis to ensure that we are ready to respond to any activity or event that we deem necessary to respond to. We do understand that this is a different environment, and we do understand that there is the need to allow as best as we can, and within the context of the orders, economic activity to continue within the city space.
Now, when asked about apartments in sections of the city that reportedly have one entrance and exit and are lacking proper fire safety protocols, this is what the mayor had to say.
I'm not aware of it. We do welcome the persons who have those concerns and persons who are aware of that. Whenever we do get complaints from residents and from citizens association, we do meet with them and we do examine all the cases. As you know, as part of the approval process, the fire department has to grant their approval for developments of this nature. And I would say that I believe that the fire department has been very, very committed and very keen on ensuring that all the necessary fire safety measures and in terms of design are in place. So I'm not aware of that, and I'm saying if anyone is aware of it, I would love to see the cases and to look at it, because it would be important. Those that you're talking about would have been built some years ago on the government program, government funded, would have been designed. I'm not aware of what. I would have, as I said, someone would have to point that out. I could ask our city engineer department to check and see, but I'm really not aware of it.
In other news tonight, Tourism Minister Edmund Bartlett says the ministry is concerned, especially during the pandemic, that the risk that everyone is facing and the uncertainty that we are all dealing with is being managed and mitigated to a level where one can say that everything that needs to be done by all is being done.
Our job in a pandemic, which is characterized by uncertainty, a magnitude of which the world has never seen before, is not to do all the things that is imaginable to be done, but is to do all the things that we should do well. And we have not been doing that sufficiently. So the spread that we are experiencing of the virus in communities, and a lot of them in the northwestern parishes and so on we are hearing about, is resulting from our not doing what we should do well. We're not wearing our masks. We're not keeping physical distancing. We're having parties everywhere. We are using bike taxis to carry 4 and 5 people. On a little bike, 4 and 5 people. We're not staying home and making family and operating within that space as we should. We're not working smartly either. And our transportation system, we're still not following the rules of low density. But in the tourism side, we have been following the rules. Every hotel in Jamaica is now fully compliant.
Minister Bartlett also stated that the tourism sector has invested a lot in dealing with the pandemic, with the creation of the Tourism Elegant Corridor, which is considered internationally as a model.
Every webinar that I go on, the question is, explain to us about the Resilient Corridor in Jamaica. And that corridor has acted as the bubble for international visitors who come in. And we don't use the word quarantine to describe what happens in there, but the effect is that. So the spread is less likely to come from the corridor than from other areas where visitors who are not international guests, but our own Jamaicans go to. And I want to make a special appeal on this moment, because we have cousins that are going to come. We have aunties and uncles that are going to come for Christmas holiday. We know because we see the flights are being booked. And the bookings look good with Jamaicans coming home. And when they come home, they can't avoid sometimes going to meet, because we have large families, don't? And Christmas is celebration time, where we're begging you, do the right thing. Tone down the Christmas celebration. Keep the numbers that we say to 10 to 15. And don't expose grandma and granddad too much, because you know that that's the age group of those who are most susceptible to being infected.
Meanwhile, the Minister of Tourism unveiled the road safety improvement project that spans Oracabessa in St. Mary to Spot Valley in Montego Bay that is funded by the Tourism Enhancement Fund. Speaking at the unveiling ceremony held earlier today at the Montego Bay Convention Center, Rose Hall Road, Minister Bartlett pointed out that safety and security are the hallmarks of destination assurance, adding that road safety plays an important role.
But we must back up that assurance with some hard action, influenced by policy and directed in time by clear minds and a direction that is understood. So when we collaborate with the National Works Agency to ensure that the ability of our visitors and locals alike to traverse the highways and the byways with a feeling of confidence that it is going to be all right if I use this road is critical. And to put dollars against our own commitment is really to establish that we are truly serious about this undertaking and this commitment that we give to our market. So $116 million that we put to work with the NAA in putting in these cat eyes and these markers, these raised markers, to enable our commuters of our highway to do so with a greater sense of surety as to where they are driving, and more importantly, encroachment on others who are using the highway. But when our visitors come to the country and they are not accustomed to our road system, they need markers, they need guide, they need signage, and that's the essence of road safety for us.
Executive Director of the Tourism Enhancement Fund, TEF, Dr. Kerry Wallace, in his remarks, explained that the project included road markings and installation of raised pavement markers, or cat's eyes, and forms part of the ministry's support to improve road infrastructure and reduce accidents.
Through St. Anne, through Trelawney, and we ended in Spot Valley just a few months ago. The project included not only removing some of the raised markings that were there, that were no longer relevant, but to add new ones and to also install over 10,000 cat's eyes, which are the reflectors that are there on the markings on the roads. It's providing, obviously, a very easy to recognize markings on the road, to make it so much more easy to drive on, and to help persons to be safer when they're traversing that corridor.
Now, on his part, Director of Planning and Research at the National Works Agency, Patrick Rose, said that engaging with the TEF in doing projects of this nature has been good in improving road safety.
Driving here from Kingston, it makes it pleasurable. You know exactly where you should be, You know where the turnoffs are, the arrows, etc. All of that has been done. We have signed off on this. It has been a joint partnership with the TEF at every stage, wherever there are inspections to be done. It's done jointly, Dr. Wallace, with your team. And I think that this partnership has been good. The cat's eyes, as you call it, well, the term that we use is raised pavement markers. They do make a difference. The type cat's eyes that we have, the 3M type, it's very luminous, very reflective. So in the nights, it really, really makes you know where the center of the road is, where the edge of the road is, things like that, where the little ghost islands are, etc. They have all been delineated. So I look forward to working along with the Ministry of Tourism through the Tourism Enhancement Fund for many years to come, especially in the tourist areas.
Mayor of Falmouth, Colin Gager, in his remarks, stated that this initiative brings him joy, as this is another indication of the efforts being made to protect the lives of citizens.
Indeed, in these times of uncertainties and calamities, anything that can be done to save lives should be lauded and applauded. I must commend the Ministry of Tourism through TEF, the National Works Agency, the National Road Safety Council, and all the other stakeholders groups who made this possible. You see, this leg of the North Coast Highway is a heavily trafficked route, and you can understand why both locals and visitors traverse this corridor for numerous reasons. Both Falmouth and Montego Bay are towns with many tourist attractions, and both towns have residents traveling back and forth for work. One of the unfortunate realities is that it is a corridor prone to accidents. I am happy to witness this launch, which, after project completion, will mitigate against the dreadful accidents which now take place. I know that this road safety improvement project brings about a great sigh of relief for many of us who uses this leg of the highway and are exposed to the risk.
As we continue with the news tonight, detectives in the division are probing the circumstances surrounding the abduction of 18-month-old Akelia Patton, otherwise called Paris, of James Hill, Clarendon, and retirement in Granville St. James on Monday. Akelia is of brown complexion, medium build, and about 2 feet 6 inches tall. She also has a milk spot on her upper lip. Reports coming into our news center tonight are that at approximately 10:30 a.m., Akelia and her mother were walking along Humber Avenue in Montego Bay when they were accosted by 2 men armed with handguns who alighted from a black 2010 Toyota Voxy and took the child. The mother escaped injury and reported the matter to the police. The police are appealing to anyone with information that can assist in the safe return of Akelia Patton to contact the Barnett Street Police at 876-952-2333, Police Emergency 119, or the nearest police station. In news from St. Catherine, the Spanish Town Police are renewing their appeal to the public for assistance to locate 34-year-old Jason Ray of Brunswick Avenue, as well as Princess Rose and Domain Ray. Jason Ray has been missing since June 2009. He was last seen leaving home at approximately 6 p.m. In the more than 10 years that have elapsed since his disappearance, the police have made numerous attempts to locate Ray. Investigators recently ascertained the names of 2 persons believed to be relatives of Ray, Demain Ray, and Princess Rose, and are now appealing to them to make contact with the police. Demain Ray, Princess Rose, or anyone knowing their whereabouts or the whereabouts of Jason Ray is being asked to contact the Spanish Town Police at 876-984-2305 or the nearest police station. And those are the stories making news. I am Shelly-Ann Hill. We will now take a break and then join Christopher Scott with sports.